So today, we're going to talk about something pretty amazing, how artificial intelligence is basically becoming a co-pilot for doctors, helping them navigate the really tricky world of chronic disease. And we're going to follow one patient's story to see how this isn't just about crunching numbers, it's about changing lives.
Okay, let's start here. We meet a man named Mr. Farouk, who's 68 years old. This single sentence from his medical file, it's more than just a clinical note, isn't it? It paints such a clear picture of his daily reality. I mean, just imagine, a short walk, maybe to the corner store, becoming this monumental, impossible task. That's the real, human cost of this disease. And the thing is, Mr. Farouk's struggle isn't unique, not by a long shot. The condition he has, it's called chronic obstructive pulmonary disease, or COPD for short, is the third biggest killer on the entire planet. So this isn't just one person's story. It's a massive global health crisis.
So to really get a handle on the challenge here, and to see just what our AI co-pilot can do, we need to connect the dots between this one man and this global problem. Let's start with the person right at the center of it all.
Okay, so here are the details on Mr. Farouk. He's 68, he spent his life as a textile worker in an industrial part of Cairo, meaning he was breathing in cotton dust for years. On top of that, he has a 40-pack-year smoking history. You put all that together and, well, it's just a perfect storm of factors that have been hammering his lungs for decades.
So what exactly is COPD? In the simplest terms, it's a disease that slowly but surely blocks up the airways in your lungs, and it's irreversible. Think about trying to breathe through a straw that just keeps getting narrower and narrower. That's what it's like. It covers things you might have heard of, like chronic bronchitis and emphysema. And the bottom line is, over time, it just gets harder and harder to breathe.
All right, so now let's see how doctors figure all this out. Long before any AI shows up, they have to be detectives, right? They're piecing together all these little clues from a patient's file to figure out what's really going on inside their body.
The first major clue is this number right here, 43%. This is a lung function score called an FEV1. A good way to think about it is it's a measure of how hard you can blow out a candle in 1 second. A healthy person scores way, way higher. At 43%, Mr. Farouk's lungs are already severely blocked.
The next clue is his blood oxygen level. A healthy person is usually walking around at 95% or higher. Mr. Farouk is at 89%. And that means his body is literally being starved of the oxygen it needs to work properly. Every single organ is feeling that strain.
So, when the doctors put these two huge clues together, the major blockage in his lungs and the low oxygen in his blood, they land on this diagnosis: GOLD Stage 3. That's a severe form of COPD, and it means Mr. Farouk is at a very, very high risk of a sudden, life-threatening emergency.
But this is where the story starts to change. I mean, with all this data and such high stakes, how can we do better? How can we actually predict those emergencies before they happen? Well, let's bring in the AI co-pilot.
What you're looking at here is a fundamental shift in medicine. See, traditional care is often reactive. You feel sick, you go to the doctor. You have a crisis, you go to the hospital. But AI-powered care is all about being proactive. It's about using data to predict and prevent that crisis from ever happening. It's a move from one-size-fits-all to totally personalized care. It's a game changer.
Now, this AI co-pilot isn't just one single program. Think of it more like a team of specialists with superpowers. You've got the forecaster, which is like a whole squad of digital detectives sifting through the evidence to predict a future crisis. Then there's the sorter, which is basically a sorting hat for patients. It groups them with others who are just like them to find the absolute best treatment. And you even have the observer, which can spot tiny patterns in an X-ray or even hear the subtle difference in a cough that a human ear might miss.
Okay, so that all sounds great in theory. But how does this AI actually think when it looks at a real person like Mr. Farouk? Let's follow its checklist step by step.
The AI follows the same clinical rules a doctor would, just with incredible speed and accuracy. So, first, it checks the lung function ratio. It's below the threshold. Okay, check. Diagnosis, COPD. Second, it looks at that 43% FEV1 score. Check. Grade, severe. Third, based on his history, it nails down his specific type of COPD. Fourth, it spots the signs of a bacterial infection. Fifth, it flags clues pointing to heart strain. And then finally, it puts all of that together to come up with one final risk score.
And look, this isn't just about getting a fancy, high-tech diagnosis. The entire point of doing all this is to create a clear, actionable plan that can actually change the course of Mr. Farouk's disease. And here it is. This is the big number from the forecaster.
It gives Mr. Farouk a risk score of 0.87 out of a possible 1. That's not just a warning, it's a massive blinking red light. It's a quantifiable alert that tells his doctors, hey, this patient needs urgent, proactive help right now.
Next up, the sorter AI gets to work. It analyzes all of Mr. Farouk's data and bam, it puts him squarely in cluster 4. Now this isn't just about putting a label on him, it's huge because we know from tons of past data that patients in this specific chronic bronchitis group respond best to a very particular set of treatments. The AI has found his medical tribe.
So, what does this all lead to? It leads to this: a personalized, proactive plan. Because of that super high-risk score and his assignment to Cluster 4, the AI helps build this targeted approach. It suggests specific drugs to prevent infections and help clear his airways. It recommends he get assessed for oxygen therapy sooner rather than later. And it gets him a referral to a rehab program to help strengthen his breathing. This is what it looks like to anticipate the future instead of just reacting to the past.
Mr. Farouk's story just shows the incredible potential here for AI to act as a true clinical co-pilot, turning this giant sea of data into life-saving foresight. It's completely flipping the script on patient care, moving from defense to a strategic offense. And it leaves us with a really powerful question for our own future, doesn't it? If an algorithm could tell you what's coming, would you be ready to listen?